Watch this.
We've gone from long lines wrapped around the West Ada district office last week to nearly a full week of in-class instruction. And so far, 1 out of every 3 students in those classes isn't required to wear a mask. And in a lot of schools, it's more than that. We're all feeling the mental fatigue of the pandemic, the constant news coverage, the divisiveness. Our kids see it too. But right now, getting them to talk about it might be easier than finding someone for them to actually talk to about it. You heard Governor Little talk about it yesterday. The ICU situation in Idaho is serious. Not that everyone believes what he said, but we are getting an explanation of what is actually happening at area hospitals. They started the school year with a campus-wide mask mandate. And now, just 1 week later, Boise State University students and staff are getting a campus-wide warning. We just received this email sent to students and staff, and in it, Boise State President Dr. Marlene Tromp says the number of infections in the campus community on track to outpace what we experienced last year. Additionally, students testing positive for COVID have reported more severe symptoms than with prior variants. If campus infection rates continue to increase, she said, we likely will face temporary rolling closures, which may mean shifting face-to-face classes online or to some sort of hybrid mode. It could also mean suspending or cutting back some campus-based services or delaying or canceling large gatherings, performances, and athletic events, and temporarily returning to remote work only. It's a big sentence. There are 56 new cases on campus this week, 75 since the school year began last Monday. Way higher than this time last year, which is what prompted this email. Which means if those numbers keep going in the wrong direction, well, yeah, that could put next week's Bronco football home opener in jeopardy for fans. As of now, it is still set to go as planned, which is hoping for a sellout of fully masked fans. But as we've seen, these things can change weekly or even daily. Well, it's been nearly a week with West Ada School District back to school and back in classrooms. We'd like to pay attention to West Ada because, after all, they are the state's largest with more than 40,000 students in the district, and because the school board decided 2 days before school started to give parents the option to remove their kids from the mask requirement. So 5 days in class in the books. Has the COVID case count been enough to cause concern? Well, so far, 38 cases have been confirmed, 31 of them students, 7 of them staff. But there are 159 students in quarantine in West Ada because of exposures at school. 44 of them are from Star Middle School, 17 from Eagle High School. Last week, when the school board granted this opt-out option, Steve wanted us to keep tabs on how it would impact schools, saying the public deserves to know the size of the local vocal minority who dictate the future health problems of our community, he wrote. And we have reported the tally a few times since, but after that 3-day window of turning in those opt-out forms into the district office, and now 3 days of parents being able to turn them in at school, well, Gaga wanted to know, what was the final percentage of West Ada district opt-out? Well, we can give you a running total, I should say, since there really isn't a deadline and parents can still opt out at any time. But as of yesterday, 32% of students in the district have opted out of the district's required mask mandate. That's just under 13,000 kids in the entire district, about 12,912. And some schools have seen more than others, though. So where have there been more opt-out forms turned in? Here's what the West Ada School District looks like. From the north at the Ada-Gem County line, west to the Canyon County line, it then jumps over Kuna and stretches southeast to nearly the Snake River. All right, way up north, where we find Eagle and Star, that area has the highest opt-out percentage, with 41% of the students. But it doesn't have the school with the highest percentage. That belongs to Paramount, with 58%, helping push the western group of Meridian Elementary, Middle, and High Schools, and Rocky Mountain, to a total of 31%. That's just under the district-wide average. In the east, that's the older part of Meridian, closer to Eagle Road. It's home to Centennial High, Chief Joseph Elementary, Lewis and Clark Middle School. They would be the lowest when it comes to area percentages, well under the average at 22%. It's also where we find Ustick Elementary, one of 3 schools with only a 13% opt-out rate. How about the south, which is south of Fairview Avenue? That's where we find Mountain View and Owyhee High Schools, Lake Hazel Elementary, and Victory Middle. There, 26% of parents have opted their kids out of wearing masks. West Ada's virtual schoolhouse has only a 2% opt-out rate. I mean, most of them are at home anyway. And that's included in the eastern area average, which obviously helps lower that percentage. These numbers are by no means final, by the way. There's 49 schools in the district, and parents can still opt out of that mask requirement through their students' school. You can see the percentages of the entire West Ada School District broken down by school, and they are on our website at ktvb.com.
I have directed $20 million towards expanded testing in Idaho's K-12 schools to help us meet testing needs.
That was Governor Little at a press conference at Nampa High School back on August 12th before school started. And the number's actually $30 million, not $20 million. Governor later corrected himself. It's been a few weeks since then, and as we've reported, schools have started to see students and staff test positive for COVID as school has gotten going in these last couple of weeks. Well, during yesterday's COVID media briefing, state health officials said that money is now available.
As a follow-up from last week, $30 million is now available for schools K through 12 that choose to avail themselves of this flexible funding. It's a simple registration form for these funds. That can be found now at the State Department of Education's website. So I wanted to follow through from our commitment to make that available the last couple of weeks, and you can find it there for any school who chooses to take that on.
And choosing to take that on means that schools have to opt in order to receive that funding. Boise School District says they have opted into that program. Spokesman Dan Holler also told us, in addition, on Thursday of this week, we will take delivery of more PCR tests from Central District Health. We're committed to mitigation measures, he says, such as testing, which protects our students and staff, also helps ensure we can continue to provide our students with 5 days a week in-person learning. West Ada School District says they are still in that decision-making process on whether they're going to make themselves available to these funds. Healthcare professionals across the country continue to work overtime as hospitalizations surge. Those are the physical healthcare workers. The mental health care professionals, well, they've also working overtime. It hasn't been easy on any of us to handle this pandemic. But getting an appointment to see one, at least in the state of Idaho, now nearly impossible, at least in a timely manner, because the demand continues to rise to see them. And that includes psychologists, specifically for children and adolescents. Some are developing anxiety and depression as they head back to school, and some for the first time in 18 months. Demand has gotten so high, to see a psychologist at St. Luke's Children's Hospital, you're going to need to wait at least 3 months. Katya Stepovic was able to speak with one today to get a better understanding of what is triggering some of these kids.
The division and the divisiveness is just really, really hard on our kids.
Angela Saita is a mother of 3. Her kids are enrolled in the only charter school near her that requires students and staff to wear masks.
They're excited to go to school because that is their socialization, but there is that idea of protecting the older family members in the household.
The elderly members in her household are against vaccination, and now her kids are worried about going to school and bringing the virus home, especially her 9th grader who is immunocompromised with type 1 diabetes.
He's anxious about the people that don't take it seriously because he is so passionate that he does have conversations in school about it. And it's really hard for him to not get angry with other kids' parents. He's becoming really judgmental about that.
According to child psychologist Dr. Goodmanson from St. Luke's Children's Hospital, her son's behavior is not unusual because child anxiety and depression is at an all-time high.
We continue to not be able to keep up with the demand. We were already in a bad spot before this pandemic started, and now I would say we're even less able to meet the need.
She says for a child looking to speak with a therapist, it could take a minimum of 3 months. If one needs medication, you're looking at 6 months. And for a psychological evaluation, it will be anywhere from 6 to 8 months before that can happen. And if you're thinking the pandemic has something to do with it, you're not wrong.
A year ago, there were a lot of unknowns. We were just trying to make the best decisions we could. And we were more or less all working under the same kind of rules and regulations, and the shift in terms of now the availability of vaccines for some people, the more, I think, increased variability of what schools are doing and what parents are requiring, make that more difficult. Because again, there's potentially a choice point or a judgment of some sort.
She says kids are accustomed to following the rules that grown-ups tell them to. She actually sees small amounts of frustration from kids when it comes to masking, but it's more so the split opinions and opportunity for judgment that increase those anxiety levels.
It's probably more difficult if you are in a family where, your school's guidelines are maybe at odds with what your family believes or thinks. And so kids pick up on that real quickly, and that can be a tension.
Dr. Goodmanson says the unknowns and the uncontrollable changes from the pandemic impact the providers too. And now more than ever, listening to one another is a must.
Somewhat new territory in that it can really make it more challenging to leave work at work, and to figure out how to balance self-care with this really increased need for supporting others through these challenges.
All right, so Katya, 3 months to see a psychologist, 6 months if you need medication. That's a long time. What can parents do? I mean, that's a lot of time to kind of work it out on your own, as they say.
Well, it is. There's no doubt about that. And in the meantime, she says, if you have a pediatrician or a school counselor, make a time to see them if that's an option. But also, as hard as it may be, Dr. Goodmanson suggests trying to talk to kids about how they're feeling. And she says it's very, very hard to do, but it's important to get them to open up. And when they do, tell them that what they're experiencing is normal. This has all affected us in one way or another, and that we will, however long it will take, we will somehow overcome it, and they need to know that.
Exactly. And when some of us have kids in that age range right now, and yes, it is real. Those frustrations that they see at home or at school, they bring them home. And of course, talking about it, that's probably step one and probably the most important step to get them to talk about it in general.
Exactly.
All right, thanks, Katya.
There's little doubt this latest surge of COVID cases is overwhelming our hospitals. But what's being said about it doesn't always match what is written, especially when it comes to available beds. Well, there's actually a good explanation for that. You need us to break something down for you? Well, COVID-related or not, you can ask us questions about any topic. They're always welcome and encouraged. Text them to us directly, 208-321-5614. Just be sure to include your name and the hashtag the 208. And I hope you don't mind, we might share yours at the end of the show or on another.
Yesterday's announcement by Governor Little, the one where he explained the dire situation facing our hospitals across the state, prompted a lot of phone calls and questions and even accusations from our viewers. Several of them curious about the ICU capacity based on what the governor said. Like this one, there are only 4 standard adult ICU beds available in the entire state, is a quote. Why doesn't that match the count of available ICU beds on the Idaho COVID-19 dashboard? It has 72 beds as available as of yesterday. And yes, that is what Governor Little said. As of yesterday, there were just 4 adult ICU beds available in Idaho. And yesterday, there were 72 available on the website. Today, there are 31. Before we consider that huge drop, let's talk about what that question is. It's still not 4 that the governor mentioned, right? But we'll let Idaho's Department of Health and Welfare, Elke Shaw-Tulloch, explain it.
The data that we have on our website indicate not just adult ICU beds, but it also includes pediatric ICU beds, and it also includes all beds total in the hospital. But what we really hear on the ground level is that ICU beds, of course, have to be staffed. They're short-staffed, so they can't necessarily use those beds if they don't have the staff to provide that.
Okay, so there's a lot to unpack there, but those numbers that she mentioned, they can change minute to minute, she told us. And what's available now, that can be filled 10 minutes later. And it's not instantaneously reported to the state website. Okay, so you heard her mention that. An ICU bed by itself, it's not going to cut it. That's not enough. They need nurses and staff to attend to that patient in that bed. And if they don't have that staff, well, they can't use that bed, even if it is listed as available. All of that, by the way, is written next to an asterisk on the state's website. Just got to scroll down a little bit, written right underneath. But none of that is good enough to convince a lot of our viewers about what is happening in our hospitals, like this one, from someone who keeps hearing about all the people in the hospital and in the ICU, who said, then I hear from nurses and other medical staff, there's hardly any people sick with COVID in the hospitals. So who's telling the wrong information? This has been going on since this all started. Is the government reporting false numbers for some kind of kickback? I'm not the only person thinking this. Okay, well then there's this voicemail.
Hi, I would just like to see you guys report the truth on the number of ICU beds available in the state after the governor's message today. It's not because there's so many COVID patients filling up our hospitals. It's because with the mandate for the vaccine, there are nurses and doctors quitting right and left. Quit using your scare tactics and report the truth.
Well, of course, that was an anonymous phone call. But let's talk about that. First, the truth comment. It's not as like we can just walk into an ICU and just start counting patients and beds and staff. So we have to rely on what the hospitals tell us to be true. What other option do we have? Also, there hasn't been anyone willing to go on the record with us to tell us what the hospitals are telling us is not true. We've tried. Can't find anyone. So just like us regular folk, let's explain this whole people not showing up for work kind of thing. Healthcare workers, they get sick too. They can either catch COVID or they can come into contact with someone who tests positive or just regular sickness. And in that case, well, they can't come to work. And if they get the COVID bug or they get close to somebody with COVID, well, they have to quarantine. And sadly, with this global health crisis stretching past a year and a half as it has now, and with Idaho hospitals coming this close to crisis standards of care twice, our healthcare workers have been asked to do a lot. And as we were told by St. Alphonsus Hospital, some of this shortage has been caused by burnout. People leaving the profession because, well, it seems to be never ending. As far as that walking away being attributed to the major medical providers requiring employees to get the COVID vaccine, that doesn't really seem to be the case either. When that requirement was announced, for example, we were told by St. Luke's their vaccination rate at the time was around 80%. As of today, they tell us 91% of their 17,000 team members have been vaccinated. St. Luke's, they're going to start confirming those numbers today. This was the deadline they gave employees to get that first dose. So it's going to take them a bit to get all of that review completed. St. Alphonsus, by the way, well, their deadline is September 15th, so they don't have those numbers available as of now. But let's look at it this way. Maybe this might help illustrate it for the doubters in the back. Think of it this way. Our hospitals, they're pretty big buildings, right? They got lots of space for lots of procedures, lots of things happening in there. And in most cases, in terms of space and staff, they're set up to handle a mass casualty event, right? And when faced with one of those mass casualty events, if need be, they can pull resources from one hospital or another to help fill in the gaps where maybe they can't call all of their staff in at once. But our hospitals, they aren't set up to handle a situation like that every day or for an extended period of time, which is kind of the situation we are in now. Except it's not just one hospital, it's all of them. One can't ask for help from another hospital because they're all facing the same crisis, and they can't spare the resources either. These are the facts, and if that scares you, well, maybe it should. This is a situation Idaho hospitals have never been in before, ever.
In the immortal words of Nellie, yeah, it's getting hot in here. Just ask the National Weather Service. It's been a record-setting summer, hot enough to melt a bunch of stuff. But you can always break out your pumpkin spice lattes and scarves. You know, fall is, well, not really officially here, but close, even if the temperatures don't tell you so. Make sure you send us your comments and questions about the show, though, before you reach for that latte. It's really easy. Just text this number, 208-321-5614. Don't forget your name and the hashtag, the 208.
All right, well, it doesn't look like we're going to set or tie the all-time record for the most number of 100-degree days in Boise. Stuck on 18, just too shy. But boy, oh Boise, you did set another all-time record this summer. Congratulations! The summer of 2021, the hottest summer ever. We know the official end of summer isn't until September 22nd, but this being September 1st, it is the beginning of meteorological fall. And according to the National Weather Service, the average temperature for June, July, and August was 78 degrees. That's the average of the highs and lows during those 3 months. In the middle of those 18 days of in the middle of those days, I should say, we had 18 days of triple-digit temperatures. Yes, we had 9 straight days of 100-degree heat, starting on June 28th and ending on July 6th. Remember this, when we started melting stuff? It was 104 degrees that day. Yeah, it was hot. We ended that streak with the hottest day of the year at 107 degrees. Well, those 9 days, they tied for the longest streak ever in Boise. Even the overnight temperatures were warm. We had 11 days in a row where the morning temperatures never dropped below 70 degrees, shattering the previous record of 5 set back in 2015. 2015, by the way, was the previous hottest summer ever. 2021 beat it by almost 1.5 degrees. And it's been a hot 21st century so far. 9 of the top 10 have happened in the last 18 years, with 6 of those in just the last 10. All right, Debbie wanted to let us know her husband works at St. Alphonsus, and those high numbers of COVID patients that we're seeing, they are accurate. Let's leave you with this. Sean said he got the vaccine, first dose. He's not going in the dark. He's feeling pretty good. And I asked him why, what took him so long, what changed his mind. And actually he said it's because of what he's seen here on Channel 7, on the 208. The information we're providing changed his mind. Thanks, Sean, for letting us know.